Hi, welcome to Healthcare Hoax videos. Remember to go to our healthcarehoaxvideos.com, and when you go there, you'll be taken to our YouTube channel. When you get to our YouTube channel, remember to like our videos, share them with family and friends, and remember also you might want to subscribe, because when you do subscribe, you'll find out about when the newest video has been posted. So keep in mind, Healthcare Hoax Videos brings you the best information for your good health, the truth about health. A lot of times you'll be getting information about disease and pharmaceutical approaches to possibly overcome disease. But here, this is where we're talking about preserving your good health. I'm Janet Cimorelli. I'm a licensed nutrition counselor with years and years of experience, and I'm right here with Dr. Herb Slavin, also with years and years of experience.
Hi, Janet.
Hi. And today we're going to be discussing some of the avenues where you might be misled. Dr. Slavin?
Well, let's talk about something that was out in the news this week, where they changed the blood pressure range. It used to be 140 over 90, and I think they dropped it down to 130 over 80.
Yes.
And I think it's true that lower blood pressure is better, but the question that remains is lower blood pressure better when it's lowered with a drug? See, that's the real issue. And there are consequences to dropping your blood pressure too much, especially in the elderly. You know, they stand up, their blood pressure drops, and then they fall down, they hurt themselves. I've seen it where doctors have lowered an elderly person's blood pressure too much, giving them a stroke, because the blood pressure can't reach the brain. See, what happens is, as you get older, your blood vessels become stiffer. So think about using a garden hose as an example. When you make it narrower, so that's the nozzle, you just narrow it down, the pressure goes up. So you naturally need more blood pressure to push the blood through a narrowed blood vessel.
How about when the blood vessels might get stiff? Does that play a role?
Well, that's a combination of the two things, narrowing and stiffness. It's the deposition of plaque in the blood vessels that create the stiffness and the narrowing.
And the plaque, I should jump in and say, the plaque is a lot of calcium, and we know that calcium is solid. It's meant to be in our bones, but it winds up in our blood vessels.
The fear of high blood pressure is stroke and heart attack.
Right.
And there are two types of stroke. The kind of stroke that occurs with high blood pressure would be called a hemorrhagic stroke. That means the pressure is so high that it causes a blood vessel to burst and you have bleeding in the brain. So that would be a hemorrhagic stroke. A heart attack, a similar situation, the blood pressure is really high, and that vulnerable plaque in the blood vessels can burst and cause a heart attack. So it is important to keep the blood pressure under control, but what needs to be discussed is the best way to do it. Now, I have patients that are happy to make the changes in their lifestyle and eating that corrects their blood pressure without adding medication. And then there are patients that don't want to do anything for themselves. Okay, so you give them the medication. And then they come back and say, I don't feel good on that medication. But some of the things that should be looked at when someone has high blood pressure. Oh, by the way, and they don't make a distinction, at least from what I read on that blood pressure guidelines, as to the age of the patient.
Interesting, because that would be a very big point. Different ages, different levels of activity, all of that plays a role. I have a question before you go on, Dr. Slavin. What about the idea of blood flow to the brain, and either with high blood pressure or reducing blood pressure with medication, that blood flow might be compromised, leading to memory issues? Is that part of this discussion?
Well, sure. If you don't have adequate blood flow to the brain, you're going to have all different types of cognitive dysfunction. So you got to be gentle with people too. You can't just drop their blood pressure real fast. It's always better to make the dietary changes. Two particular things come to mind. Make sure your magnesium level is normal or adequate or optimal, and make sure your insulin levels aren't elevated.
I think plenty of people might be really surprised that you're bringing insulin into this discussion.
Yeah, elevated insulin levels will cause fluid retention, and fluid retention raises blood pressure. So those are just a couple of things people should think about before they load up on a lot of medication.
Now, you're saying fluid retention, but I would say it's crucial to remind people that in order to keep their blood flowing nicely, they should be drinking high quality fluids, not necessarily caffeinated beverages, not necessarily sodas with carbonation or sweeteners, but water.
Yeah, drinking a lot of water isn't going to cause fluid retention. But if you have elevated insulin levels, that will cause fluid retention. I'm not even sure, contrary to what everybody thinks, that a lot of salt will cause fluid retention.
Okay, it's interesting because I'm certainly on that page that sodium really is an important part of maintaining proper mineral balance. You want sodium and potassium to be in a certain ratio, and that sodium and potassium ratio requires some salt. And I see a lot of people getting weak when they're on a no salt or low salt diet.
Very important to have a good scale in your house, especially for the elderly people, because if this changes in your weight, it could represent fluid retention. So if you see all of a sudden you put on 2 or 3 pounds, that's water weight. You didn't just put on 2 or 3 pounds of fat or muscle. It's retaining fluid. That's why a good scale to monitor it. So you can tell. Now in our office we check body composition so we can see if your total body water is distributed properly and not increased, which we see a lot. And there are a lot of reasons for that, not just high blood pressure or high insulin levels. You know, there could be heart problems that can cause fluid retention. So it gets kind of complicated. So I think what that article was really saying is pay attention to young people with high blood pressure. You know, and they can withstand, you know, the different medications, although ideally it'd be better to, you know, get their diet better, and why should they have high blood pressure? But, you know, this way, you know, after 20 or 30 years of high blood pressure, you are going to run into problems. Every organ is negatively affected by high blood pressure, from your eyes to your heart to your kidneys. So it's really important to control it. It would ideally be best to control it through proper diet, because it's what you're eating that's raising it.
Is it correct to say that as we get older, because of possible increasing stiffness in our blood vessels, that our blood pressure is going to go up? So the difference of a blood pressure, let's say 110/65, for a young person, that same person as they age, they could go up to 140/80 and not necessarily have the potential for damage. Is that incorrect?
I think that's correct to some extent. Now, we have to make a distinction when we talk about high blood pressure. You have the diastolic, which is the upper number, and you have the systolic, which is the upper number, and the diastolic, which is the pressure in your blood vessels at rest.
Right.
You don't want diastolic hypertension, so you really want to keep that number under 90 for sure.
Okay.
But as people get older, I think you have to have a little more leeway or flexibility in that upper number. Perfect example, take a hose with a nozzle at the end, and you open up the faucet, and water is coming out. Now you're not changing the amount of water or the flow or anything. All you're doing is making the opening a little more narrow, and you see the pressure increase, even though everything else is the same. Well, that happens in your body as you get older. You know, the blood vessels become a little more narrow and the pressure goes up naturally. So if you were to then to put someone on a diuretic, take fluid out of the body, or take medication that dilates blood vessels and lower the pressure, you're not going to get the blood flow to the various important organs.
So I want to let our viewers know that when you visit us for our next video post, we'll have lots of solutions. We'll talk about some of the medications that might be offered to you, but we'll talk about some natural solutions, diets and supplements that really enhance the quality of your circulation and the health of your heart. This is Care Hoax, and come to healthcarehoaxvideos.com. That will take you right to our YouTube channel, and make sure that you share our videos with your family and friends. Make sure that you subscribe, because then you'll know when our next video is posted. Thanks for watching.